Aspirins, the good, the bad, and the possibly ugly. Aspirin is often hailed as a super drug because it can protect against heart attack and stroke caused by thrombosis. So what is aspirin? Aspirin is also known as acetylsalicylic acid and is part of a group of medicines called NSAIDs, or non-steroidal anti-inflammatory drugs. The active metabolite was first discovered in 1763 and since then has become a staple of modern medicine with worldwide usage. The benefits include being an analgesic, an antipyretic, and anti-inflammatory, but is most commonly known as an antiplatelet. Antiplatelets inhibit the production of thromboxane, which for wounds are an indispensable self-sealing material. However, in strokes, thromboxane is often life-threatening, causing platelet aggregation. The American Heart Association says taking aspirin within 2 days of an ischemic stroke reduces the severity of the stroke. So, aspirin has been known to prevent deaths as well as long-term prevention. However, despite the potential benefits, antiplatelet therapy is not for everyone. So now, let's move on to a darker side of aspirin. The most common side effects of aspirin are gastrointestinal. These include anorectal ulcerations, epigastric distress, as well as the potential of appendicitis with the combination of other NSAIDs. Further serious gastrointestinal effects also include hemorrhages or esophageal ulcerations. There is also an increased risk of having epigastric pain, heartburn, nausea, and ulcers. And last, other effects include a decrease of renal function, hypersensitivity, and hematologic dysfunction, along with metabolic side effects and nervous system effects. So how exactly does aspirin work? Well, aspirin irreversibly inhibits the formation of COX-1 and COX-2, both cyclooxygenases. These cyclooxygenases produce prostaglandin and thromboxane 2, which cause platelet aggregation as well as inflammation. Aspirin has also been known to be involved in the uncoupling of oxidative phosphorylation in mitochondria, as well as playing a role in transcription factors such as NF-κB, which is responsible for inflammation. This diagram shows how aspirin is able to block cyclooxygenase 1 and thus stop the production of prostaglandins and thromboxane A2. So how exactly do the side effects work? Well, in aspirin, the inhibition of COX means that COX-1 enzymes are unable to prevent stomach ulcers by enhancing the blood flow to the stomach and increasing the production of a protective mucus. If there is a shortage of COX-1, your stomach may not develop its usual protective lining. Along with gastrointestinal walls, there are also patients with aspirin-induced asthma who are also susceptible to the blockage of COX-1, which results in the overproduction of leukotrienes and produces a severe asthma and allergy-like effect. Both of these side effects come under salicylate sensitivity, which is a form of pharmacological reaction and not a true IgE-mediated allergy. So now that we've known the good and the bad, what about the risks? Well, in general, you should consider taking aspirin if its benefits outweigh its risks. For men, the main benefit is preventing a heart attack. For women, it is preventing a stroke. Most of these risk assessment scores are often done through online calculators such as Framingham or Reynolds. Risk factors often include the use of other NSAIDs, as well as gender, where men are twice as likely as women to have gastrointestinal bleeding. Now, this is a case study of a 55-year-old man with a 10-year heart attack risk of 2%. Taking aspirin will lower it by 25% to 1.5%. If he takes ibuprofen, another NSAID for his arthritis, his chance of having a problem with aspirin is close to 4%. For him, the risk is higher than the benefit and should not be prescribed aspirin. So, in conclusion, is aspirin a good drug or a bad drug? Well, you should always have professional advice before personal opinion, and thus aspirin should be treated as a case-by-case basis and not a blanket strategy. Thank you for listening.